It's our first day of EMIS Web roadshows, and first thing in the morning we've just got a city presentation to do, and then off to the West Ham Football Club to meet our users and give them the overview of EMIS Web. EMIS Web is now installed in 4 sites, going reasonably well. The formal full rollout approval period has started, and we're going into our next sort of patch cycle to do enhancements and upgrades for the first sites. We're doing an EMIS Web roadshow in Brighton today, expecting quite a lot of people. Yesterday we had 200 or so. Other things that have been happening, Healthcare Gateway Limited has now been formed. You know, that's a joint venture within practice, which will mean that we will be able to do interoperability programs, you know, affecting 75% at least of the population of the UK. You know, so we'll be able to join up things like discharge summaries and data flows, detailed care record information into hospital pharmacy and so on. You know, so very excited by that project. It's Friday the 2nd of July. Finished first week of roadshows today. One of the things we wanted to do was kind of explain how, you know, if you've been using LV or PCS, how we've designed EMIS Web so you can migrate with no downtime. You know, so that all your appointments are copied over, all of your clinical data is copied over real time, your tasks, your schedules, your templates, your Word documents and so forth. So we've had a system, you know, somebody that was using LV for 20 years, like on Tuesday night they were using LV, then Wednesday morning, no downtime onto EMIS Web. You know, so a lot of focus on that. You know, typical data transfer can, you know, take you offline for 2 weeks. You know, so if you do a data transfer to a different system supplier, it's probably the biggest clinical and litigious risk a practice will ever make. Just wanted to sort of touch on work we've been doing with Liverpool, Wandsworth, Tower Hamlets. Again, using EMIS Web outside the GP space. You know, so throughout Liverpool now, you've got people within the hospital pharmacy, people within the A&E, urgent care centres, out of our systems, all to be able to see and share that primary care record. Some of the overall benefits of this are coming down to the amount of money that can be saved by the service by doing that. The amount of people that are actually spent auditing GP systems within the PCTs, you know, having to go out and visit every practice. Now, this idea of interoperability, you know, the I word, you know, EMIS has been banging on it about it for quite some time. It's all coming to fruition now. You know, we've now formed a joint venture with in practice. You know, so actually working with EMIS, you know, so you make sure that data is really it's healthcare anywhere, wherever you actually need to see that data. You've got legitimate consent. Let's free it up, and this is providing a gateway for companies to be able to glue together healthcare. But I think it's very, very significant that 2 large competitors are now collaborating where it comes to clinical data.